Welcome back, everyone. Let's dive right into today's explainer. We are decoding the raw, unfiltered clinical truth about men's sexual health and the modern intimacy crisis. We're getting right to the front lines of urology to talk about what's actually happening behind closed doors. How these hyper-sexualized digital environments are literally rewiring physical biology, and more importantly, what it actually takes to rehabilitate real-world relationships. So, let's get into it. To really grasp the severity of this issue, we need to start right here. This isn't some dramatic line from a movie. This is a real, direct quote from a patient case. And sadly, it's not an isolated incident. It's becoming an epidemic. We're seeing young men arriving at clinics deeply depressed, trapped in sexless marriages, and dealing with partners who are looking elsewhere because of profound dysfunctions at home. The stakes for human connection right now are absolutely massive. So, what's driving this? Well, it's something we call the virtual trap. Think about it. We live in this constantly hyper-sexualized environment now. From easily accessible internet content to just the soft-core visuals you scroll past every day on social media, the modern brain is just relentlessly overstimulated. And because so many men are using this virtual trap as a quick daily stress reliever, it is silently but completely destroying their capacity to form natural physical relationships in the real world.
Section 1. Intercourse versus shared pleasure. Let's look at a massive clinical reframing of how we even view intimacy.
Think about the semantic difference here. It's actually pretty wild. The English word intercourse, it feels so mechanical, right? Like an artificial, porn-driven act where you're essentially just performing a bodily function. Now, contrast that with the traditional Hindi word sambhog. That translates to shared pleasure, emotional intimacy, literally shared creation. What's happened is that modern habits have turned intimacy into this mechanical solo act, completely erasing the shared emotional connection you absolutely need for true fulfillment.
Section 2. The biological cost of masturbation. Let's examine the severe toll this mechanical training takes on the male body.
Now, the clinical data brings up a staggering paradox. Why do young, otherwise completely healthy men experience physical failures when they finally attempt real intimacy? Young men today are consuming record amounts of sexual content, and yet, when it comes down to actual physical human connection, their bodies are just completely failing them. Why is that? Well, the primary culprit is something called venogenic erectile dysfunction. Here's how it works. Normally, during full arousal, your arteries pump blood in and the veins close up tight to keep it there, sustaining the erection. But because so many guys are used to rapid, constant manual stimulation, their bodies are never actually trained to hold a full, natural arousal. The veins just stay open. So they literally lose their erection the exact moment they try to switch from an artificial screen to a real human partner. And right alongside that is a massive spike in premature ejaculation. This is a direct biological consequence of training the body for a rapid release. When your brain and your nerves are conditioned to reach the finish line as fast as humanly possible, usually alone staring at a screen, those nerves become incredibly hypersensitive. The brain basically learns to hit the complete button prematurely, way before any real intimacy can even get started.
30 seconds. That is the tragic reality of this conditioning. Urologists are seeing countless patients whose real-world pacing is just completely ruined, discharging in 30, 20, sometimes even 15 seconds. And it happens because the body has been so rigorously trained for this fast, mechanical release, which makes sustained shared pleasure practically impossible.
Which brings us to a massive internet myth we really need to bust: post-nut clarity. You see this all over online forums, right? The idea that chronic masturbation relieves stress and gives you this laser mental focus. Well, the clinical reality, it's actually more like post-nut confusion. Think of it like chugging a gallon of soda to cure your thirst. Instead of giving you focus, it causes a severe dopamine crash. It creates this destructive addiction loop where you do it, you crash, you lose your focus, and then you need to do it all over again just to feel normal. It completely scrambles your baseline brain chemistry. Section 3. Understanding female intimacy. If the male body is being trained for 30-second mechanical releases, we really need to understand the biology of the other half of the equation. And here is the crucial biological requirement: 8 to 16 minutes. Clinical insights show this is the average time a woman typically needs to reach climax through proper penetration and stimulation. Now, put those numbers side by side. When you compare an 8 to 16-minute biological requirement with the 30-second porn-trained reality of so many modern guys, Well, it becomes pretty glaringly obvious why so many marriages are suffering from such a severe intimacy disconnect, right? This whole disconnect fundamentally comes down to how male and female arousal contrast. Male arousal is highly visual, very rapid, and heavily physical. It can be triggered almost instantly just by swiping past an image on a screen. Female arousal, on the other hand, relies so much more on emotional connection, trust, and a much slower build that requires extensive foreplay. That mechanical, rushed approach guys are learning online, it completely ignores female biology. And that is exactly why so many partners are left feeling completely unfulfilled and relationships are pushed to the breaking point. Section 4, the recovery protocol. Now for the good news. We absolutely can reverse this physical conditioning with an actionable, clinical solution. Enter the ERP, the Erectile Recovery Protocol. It's a structured 4-step rehab process. Step 1 is tapering off this chronic habits. Step 2 is physical rehabilitation. We're talking Kegel and pelvic floor exercises like squats to actually strengthen those necessary muscles. Step 3, fix your sleep and cut out the late-night blue light, which directly boosts your natural testosterone. And finally, step 4 involves basic supplementation, things like vitamin D and L-arginine. Sticking to this protocol consistently, clinics see guys making massive physical improvements in just a month. Now, if you're trying to break the addiction loop, clinical advice actually says don't quit cold turkey. Instead, they recommend the calendar method. First, you set specific allowance days to gradually taper down your frequency. Next, and this is huge, actively remove your triggers. Get the phone completely out of the bedroom at night. Finally, when you get hit with a sudden urge, you have to break the behavioral loop by doing something physical. Do 10 squats, take a cold shower, whatever it takes. It's all about systematically rewiring your brain. Section 5, the truth about size. Finally, we have to talk about a massive internet-fueled anxiety that urology clinics deal with constantly, body dysmorphia. Let's immediately ground expectations here and get real. The average Indian size is roughly 4 to 4.5 inches. Those massive sizes you see online, that is entirely the result of extreme selection bias in the adult industry. I mean, they literally only cast the top 1% of the population to begin with. The vast majority of men fall right into this standard 4 to 4.5 inch bracket. And medically speaking, this is perfectly normal and absolutely adequate for a healthy, fulfilling relationship. And for anyone out there thinking about surgical intervention, we need to completely dismantle that fantasy right now. Enlargement surgery, it gives you a maximum 20% visible increase, at absolute best. It does not magically add new tissue. No way. All it does is cut a ligament to expose a tiny bit of hidden internal length that's already naturally attached to your pelvic bone. It's a highly elective procedure meant to treat body dysmorphia more than anything else. And it is definitely not a magic fix for any underlying relationship or intimacy issues. Which brings us to a really profound concern about where we're heading as a society. With the rise of virtual reality and AI, physical human contact is increasingly being replaced by synthetic technology. So it leaves us with a pretty provocative question to ponder. As we retreat further and further into VR headsets, hyper-sexualized digital screens, and these constant 30-second dopamine hits, are we going to lose the biological capacity and the art of true human intimacy entirely? Thanks so much for tuning into this explainer. I really hope it gave you some powerful, structured insights to think about. See you next time.